How do doctors distinguish gout from pseudogout? Imagine your joints suddenly become swollen, red, and painfully tender. Doctors need to figure out if it's gout or pseudogout to give the right treatment. The main way they do this is by looking at the tiny crystals that form in the joint fluid. To get these crystals, they use a needle to draw fluid from the affected joint in a procedure called arthrocentesis. Once they have the fluid, they examine it under a special microscope that uses polarized light. This helps them see the shape and type of crystals present. In gout, the crystals are needle-shaped and made of uric acid, also called monosodium urate. These crystals are quite distinctive and are usually found in the joint fluid during a gout attack. Pseudogout, on the other hand, features crystals that are rectangular or rhomboid-shaped and are composed of calcium pyrophosphate dihydrate. The shape and chemical makeup of these crystals are the key clues that help doctors tell the two conditions apart. Another important factor is which joints are affected. Gout often hits a single joint, most commonly the big toe, causing sudden and intense pain. It can also involve the ankle, heel, or knee. Pseudogout tends to affect larger joints like the knee and wrist, and it might involve several joints at once. Unlike gout, pseudogout rarely affects the big toe. The symptoms of pseudogout can last longer and sometimes resemble other joint problems, making diagnosis trickier. Blood tests also play a role. Elevated uric acid levels in the blood support a diagnosis of gout, but they aren't conclusive because some people with high uric acid never develop symptoms. Blood tests can also check mineral levels like calcium and phosphorus, which can help identify underlying conditions linked to pseudogout, such as hyperparathyroidism or hemochromatosis. Imaging studies like X-rays can reveal joint damage or calcium deposits in the cartilage. In pseudogout, doctors often see calcifications called chondrocalcinosis, especially in the knees or wrists. Ultrasound and quartz scans can also detect crystal deposits and inflammation. Ultrasound might show gout crystals on the cartilage surface, while pseudogout crystals are often found in the middle layer of cartilage. Finally, doctors take a detailed history and perform a physical exam. They consider factors like how quickly symptoms started, which joints are involved, and the patient's overall health. Gout is commonly linked with high uric acid levels, diets rich in purines, alcohol use, and metabolic issues. Pseudogout tends to be associated with aging and metabolic disorders like hyperparathyroidism. In summary, the most reliable way to distinguish gout from pseudogout is by analyzing the crystals in joint fluid under a microscope. This is supported by clinical clues, blood tests, and imaging. Always remember, if you experience joint pain or swelling, it's important to see a healthcare professional for an accurate diagnosis and proper treatment.